How does medical trauma cause PTSD? Imagine going through a medical event so intense that it leaves a lasting mark on your mind. Medical trauma can happen during serious illnesses, invasive procedures, accidents needing emergency care, or brain injuries. When these events threaten your life or sense of safety, they can trigger a powerful stress response. This response floods your body with hormones like adrenaline and cortisol, preparing you to fight or escape danger. But if this response becomes overwhelming or stays active long after the event, it can lead to post-traumatic stress disorder. In PTSD, the brain's ability to process and store memories properly gets disrupted. The amygdala, which is responsible for fear and threat detection, can become overactive. This makes you feel afraid even when there is no real danger. Meanwhile, the hippocampus, which helps put memories into context, may shrink or not work correctly. This causes intrusive memories, flashbacks, and nightmares about the traumatic medical event. The stress hormones released during trauma can also cause lasting changes in brain chemistry. These changes can keep the nervous system in a state of hyperarousal, where you are constantly alert, anxious, or easily startled. This heightened state can make it hard to relax or sleep, and it can interfere with daily life. Medical trauma can also trigger neuroinflammation, which is the activation of immune responses in the brain. This inflammation can impair how the brain adapts and learns, making PTSD symptoms worse. For example, if someone suffers a traumatic brain injury, the physical damage and subsequent inflammation can increase the risk of developing PTSD. Psychologically, feeling helpless or out of control during a medical crisis adds to the trauma. Pain, uncertainty, and loss of independence can make recovery difficult. These feelings can cause someone to avoid medical settings or reminders of the trauma, which is a common symptom of PTSD. In summary, medical trauma causes PTSD through a mix of biological, neurological, and psychological factors. The stress response becomes dysregulated, brain areas involved in fear and memory are affected, and inflammation may worsen neural function. The emotional impact of feeling helpless or overwhelmed can trap someone in a cycle of fear and avoidance. Recognizing these processes highlights why early support and proper medical care are essential. If you or someone you know experiences symptoms after a medical event, consulting a healthcare professional can help manage and treat PTSD effectively.